Dr. Rubin, could you please give me and listeners a little more information on a cellular level? How does that low intensity vibration improve bone health? And if you don't mind talking about it, like in terms of muscles and in terms of bone, but also in terms of bone quality and bone density.
Sure, I'd be happy to give it a try.
Thank you.
Essentially, the bone world, whether you're speaking with your orthopedist or your general practitioner and everyone in between, everyone is familiar with sort of a use it or lose it phenomenon in the musculoskeletal system. If you're a couch potato, if all you're doing is binging Netflix, etc., which I'm certainly guilty of, you're not really loading up your musculoskeletal system. And it's an adaptive system, so it will actually begin to waste away. And almost immediately, within 24 hours, you start recruiting cells that start to break down tissues if you're not loading it up. Think of our colleagues that are brave enough to go into space, astronauts, for example, that to compare, we are basically peak our bone mass around the age of 35, and we lose around 2 to 3% bone per decade after that, both men and women. You know this very well. Women following the menopause can lose 2 to 3% per year, rather than per decade, per year.
And some a little faster.
And some a little faster, right? And so there's this accelerated loss during the peri and postmenopausal period. Astronauts are losing 2% per month. So why is that? These are, really well-trained athletes, yet they're going up into space. What's the difference between an astronaut and us? Is they're losing that G, that Earth's gravitational field, the load of the bone. So the use it or lose it goes to the other side of that window as well. You think of some of our great tennis players, Serena or Venus Williams are good examples. Professional tennis players have about 30 to 35% more bone in their playing arm than the arm that simply throws the ball up into the air. So somehow, the cells in your bone and around the bone are somehow able to perceive the mechanical challenges they're faced with and respond to them. So you begin to exercise more and more, the cells pick up this signal and build up not only bone density, the amount of bone you have, but bone quality. Think of bone quality as the way that the bone is put together. So you have both cortical bone, that dense cortical bone that is sort of that bone that when you wham your shin against a desk or something, that's dense cortical bone. Towards the ends of the bone is more trabecular bone, surrounded by a shell of cortical bone. And that's really the bone that's more metabolically active and the first to leave us as we age.
And that is the type of bone we have more in our vertebrae and in the neck of the femur, which is why the DEXA is down there. Yeah. Exactly
right. And that's why some of our areas, our regions of greatest concern in osteoporosis happen to be correlated, femoral neck and vertebrae, to where that trabecular bone is. So the trabecular bone is more like struts of bone. Think of the scaffolding that holds a building up, right? You wouldn't want a building that's filled with concrete because then you couldn't go into it. That's why you have all this structure around the perimeter of the building to hold it up. But as these struts begin to break down with age or disuse or disease, the trabeculae, which are all interconnected, and they're beginning to break away, that even with an anabolic therapy, it's very rare that the trabeculae reconnect. So even though there may be a buildup of bone density, there still may be a loss of bone quality.
And your anabolics are the things like your Forteo or Evenity, things like that.
Right, so parathyroid hormone. So I think of it more about, rather than trying to condemn the drug makers, think of them as sort of their chemical constituents. Parathyroid.
Sorry.
So I think all of us, whether it's your listeners or me or your son in the gym, what we really want to do is we want to figure out how to maintain our skeleton as long as possible, how to keep it healthy. It's much, much easier to maintain a healthy skeleton than to lose it and try to build it back.
Mm-hmm.
So to your original question, how do the cells see this? So you don't think of your skeleton as this dried out bone in the desert, like a Georgia O'Keeffe painting or something. It's a very live, viable tissue. It's actually the only tissue in the body that can heal without leaving a scar. It's amazingly sophisticated. There are the bone-forming cells, the osteoblasts, and there are the bone-eating cells, the osteoclasts. There are also these cells called osteocytes, which, just like a kitchen sponge, they're all in the sort of little pockets of the sponge that are all interconnecting all the cells throughout the bone tissue. There are cells on the surface of the bone called the periosteum and the endosteum. But also where our research is pointing to is in the bone marrow. So encased within your bone is the marrow. And to me, the marrow, and I certainly wouldn't be the first to say this, it's the key to the health of many, many systems. There are two types of stem cells in your bone marrow, and I'll try to explain both of them to you. There is the hematopoietic stem cells. These are the things that are critical to your immune system, your B and your T cells. The hematopoietic stem cells are your progenitors for your immune system. Meaning they are the things that become the T and the B cells which fight disease.
Timely with COVID, yes.
Right, absolutely critical to COVID. And these progenitors, what makes them multi-potential progenitors is they can differentiate or grow up into different things. They can grow up into B cells, into T cells, or they can become macrophages like osteoclasts, those bone-eating cells.
Yeah.
So chewing them up. So these hematopoietic stem cells are making a decision within the bone marrow. What do I do when I grow up? The other stem cell in the bone marrow are called mesenchymal or mesenchymal stem cells. These are cells that can grow up to become bone cells, or they can become cartilage cells or tendon cells or ligament cells. They can also become fat cells called adipocytes. So these cells in the marrow are sitting there trying to decide what they're going to do when they grow up, just like your kids when they're in high school. Gee, am I going to become a lawyer or a doctor, or am I going to become a couch potato? What are we going to do when we grow up? So what are the signals that tell these stem cells what to do when they grow up, both the HSCs, the hematopoietic stem cells, and the MSCs, the mesenchymal stem cells? There are growth factors, there are cytokines, there are lots of different factors which tell them what to do. But they're also responsive to mechanical signals. Mechanical signals can cause fate selection in your stem cells. With me so far?
Yep.
Good. So how do we tell those stem cells in your bone marrow to grow up and become bone and muscle and ligament and tendon and not become fat? So if you have a cell population that's mechanically responsive, the question is what mechanical parameters are best suited to stimulate a response, or in our case of bone cells, to stimulate bone formation. So if you remember that exercise is good for you, right? Walking around the block or running to the bus stop is all a stimulus to your bone. You begin to wonder about how is force generated to your bone from your muscle. So as your muscle contracts at 1 cycle per second, if you're lifting up a weight, or you're lifting up a coffee cup, something like that, you're lifting up, challenging your muscle and challenging your bone at 1 cycle per second. Well, it turns out that the way that muscle actually contracts as it's pulling together, that it's really an inefficient motor. So as muscle is pulling and contracting, it's not really smooth. It begins to shake. It turns out that it shakes between 20 to 50 cycles per second. So now, if you're walking around the block, or if you're Usain Bolt running at the Olympics, your force generated by your muscle is not only contracting at 1 cycle per second, but it's doing so by pulling together and shaking as it does so. So, when we think of it in the context of low intensity vibration, what we're trying to do is provide a surrogate for that shaking of the muscle. Because what we've found is not only are bone cells responsive to 1 cycle loads, big displacements, they're also very, very sensitive to very small, high frequency, high cycles per second stimulation, right? So you could pretend, if you pretend that you are a bone cell, you could either wait for that 1 cycle per second load. Maybe you're responsive, maybe you're listening, maybe you're not. Or you could think of what it's always seeing, which are your muscles contract, your muscles are inefficient motors, they're essentially vibrating. That vibration is transmitted to the bone and the bone cells. The bone cells see a predominant signal during the day is this 30 cycles per second shaking or vibration. So with low intensity vibration, what we were trying to do is stimulate the bone cells to think that they're challenged by running a sprint in the Olympics, right? It's not something many of us do, but by standing on this device, as low intensity as it is, as far as the bone cell is concerned, it's actually quite large. So 30 cycles per second, 30 hertz, at the displacement that we are interested in, causes an intensity that's actually anabolic or is a stimulus to bone cells. So the reason that we in our lab or in our clinical trials, or perhaps that you and your subjects might be interested in, is this 30 hertz signal, this 30 cycles per second, is a surrogate for high intensity exercise. You don't need to go out and lift 1,000-pound weights. You can just convince your muscle or trick your muscle into thinking that it's doing so. And that's why we use low intensity vibration. So what we've found, starting with bone cells, is bone cells were more and more responsive to frequency. But then we thought that if you want to build bone, back to the anabolic therapies we were talking about earlier, you can either try to activate the quiescent or the sleeping bone cells on the surface of your bone to tell them to wake up and start forming bone, or you can recruit more bone cells to that task. And where do you get more bone cells from? You get them from the bone marrow. You get them from the progenitor population. So we decided that if we could activate the bone marrow population
before they turn into fat.
And that becomes part of the story, that if you could drive your MSCs, your mesenchymal stem cells, and make them commit to become the lawyer or the doctor or whoever we want our children to be, we make them into bone cells, there are more bone cells to make bone, which is good. But you're absolutely right, which again, we never expected. What we found was as we drove those MSCs to become bone, what didn't they become? They didn't become fat. So it's not how long you do it, it's what you do.
Mm-hmm.
Think of turning on your bone cells to be responsive as like a light switch. Once you turn on the light switch, even though you might force that light switch up higher and higher and higher, the lights don't become brighter. You've turned them on. So you just need to make sure, right exactly to your point, how often do you need to do it? That how often do you need to do it? You need to do it at least once per day.
Okay.
First point. You can't do it once a week or 3 times a week or something like that. You need to do it at least once a week. And let me tell you.
At least once a day. So you.
Once per day.
Yeah, okay.
I'm sorry. Right. If I said something wrong, once per day at least. So we do experiments in cells, in what are called preclinical, in things like mice and rats, and we do clinical trials. It's easiest to do it in cells. And if you look at the architecture of a cell, how a cell is put together, they have something ironically called a cytoskeleton. Just like we have a skeleton, a cell has a skeleton. You take those cells in a dish and you look at them under the microscope, and the cytoskeleton looks a little scrawny, an osteopenic cell, if you will.
Cute.
If you do something like add a growth factor, or if you mechanically load it, the cell adapts. The cytoskeleton becomes more robust. And you say, wow, this is really cool. The problem is that 24 hours later, that cytoskeleton disappears. It goes back to being a couch potato cell. So you have to actually load that cell. So all of our cells, and imagine all of that biology going on in the world right now, where their cells are sitting in an incubator being couch potatoes. These are, I think, bad models for disease. So you have to load your body once per day. As it turns out, however, that so going back to the light switch, you don't need to do it very long. If you have the right signal, and we'll get to that the right signal will turn on the light switch, let's say in 5 minutes of exercise. That exercising for an hour doesn't turn the light switch on anymore for your bone. So get the right exercise. So your challenge for your patients is getting the right exercise. I would suggest to you and to your patients to do that several times per day rather than one long period of 1 hour. And I'll tell you why. If you look at those cells and you stimulate them to adapt, right? The cytoskeleton becomes stronger. If you keep doing it in real time over the course of, let's say, an hour, the cytoskeleton doesn't become more robust. It's adapted to its challenge. You stop stimulating the cell and you wait for, let's say, 3 hours, 1 to 3 hours, and you stimulate them again before the cytoskeleton moves back to its couch potato state. The cytoskeleton itself adapts again and again and again. So not only does the cell have a more robust cytoskeleton, the beauty of it is there are more elements of it to perceive mechanical signals. And why it's important to you and me as we think about osteoporosis, and why is it that young people can go out and play tennis with Serena Williams, is because their body is young and healthy and strong, and they don't need these sort of signals. I would say that if anyone's listening that's 25 years old, healthy, out running marathons, et cetera, you don't need to stand on a low-intensity vibration device because your cells are being stimulated and it's all good. However, if all you're doing is binge watching Netflix, even if you're 25, your cells are descending into a place that they're going to have difficulty responding to mechanical signals. And going back to your earlier point, that not only is the marrow driving those stem cells to become fat and growing up, fat in your visceral cavity around your heart, your lungs, your liver, your kidney, and the subcutaneous fat that we become, it's really ugly and we don't look as sharp as we used to. It's also filling up your marrow with fat. And your marrow begins to displace all of these cells that are so key to your immune system and your regenerative capacity, that if it's filled with fat, because you're a couch potato, or it begins to age, as we all do, and becomes actually, rather than red and filled with blood, as sort of like teenagers and children have, and we become sort of adults and middle-aged people, it becomes sort of more yellow. And then as we get older and older and older, it turns gray and begins to die away. That again, just like osteoporosis, you want to keep the skeleton you have to avoid trying to rebuild it. You want to keep your marrow happy and healthy, because not only is it important to osteoporosis, it's important
for the immune system. And
to the immune system. That's, it's absolutely true. I mean, whatever anybody says about exercise, nobody really knows how exercise works. Everyone thinks that you eat an Oreo and you go out and you exercise and you burn it off and it's good for your cardiovascular system. All of that is true. But don't forget, what we have been talking about is your cells themselves are picking up these mechanical signals, and they're changing what they are and who they become. I'm being a little teleologic here. I'm sorry to sound so corny, but it's absolutely dead true that unless you are mechanically challenging your body, things will descend to a sort of a dormant state. At least once per day, to keep the cells from descending into a transient state, into a sort of a sleeping state, but then to try to ratchet up the sensitivity of the cells by doing it several times per day. And we have found in our mice and in our clinical trials that if we buzz, so I think of low intensity vibration as buzzing, if we buzz our subjects, be they mice, be they cells, be they people, 2 or even 3 times per day, the outcomes are even more robust. So it's not buzzing for an hour per day. It's buzzing for 5 minutes separated by what's called a refractory or a rest period, and then buzzing again, resting, buzzing again. Your whole adaptive system becomes more responsive. The problem with that is in the lab where I am here, it's very easy to tell my cells to buzz 3-5 times a day, right? Because my cells do what I tell them to do in the incubator. Or my mice, because my graduate students will buzz the mice 3-5 times a day. But to tell Mrs. Jones or Mr. Smith to stand on a device 5 times a day, it gets a little old, right? I mean, you can talk on the phone, but you're not on a paint shaker, you're just staying on a device. But how to incorporate it in your day becomes a challenge. So I suggest to people 2 times per day, once in the morning while you're brushing your teeth, once in the evening while you're washing dishes, you're good to go. And just so I don't forget that, going back to the issue of fat, building up bone, the seesaw being that you aren't building up fat. We have shown this not only in cells, driving our stem cells to become bone, they produce a lot less fat cells. We have shown it in mice and in rats, not only normal mice, but mice fed a McDonald's type mouse diet. Oh boy, it's a Big Mac for mice, really high fat diet, where the control mice become morbidly obese. But the buzz mice not only have significantly less fat, they have significantly more bone, right? Because driving those stem cells to make good decisions. We have shown in our clinical studies, like the Gilson study on osteopenic and osteoporotic young women. There's a study done at the Keck School of Medicine in Los Angeles. He took young osteoporotic women between the ages of 16 and 20.
Mostly maybe like people that had maybe eating disorders or were valid.
Well, actually, their inclusion criteria is they had to be in the lowest quartile of bone mineral density, and they had to have at least one fracture due to osteoporosis. So their conditions of why they were osteopenic could be genetic, could be an eating disorder, could just be bad luck, could be their couch potatoes, whatever, that they were all osteoporotic. And in that study, what we were able to show is after 1 year, the women, the young ladies, the young women that were on the control device continued to lose bone. They didn't build up bone. And lo and behold, they gained fat, both in their thoracic cavity and their subcutaneous compartments. We didn't have the technology when that study was done to look at marrow, but if you remind me, I can address that in a second. The young women who stood on the device, they were asked to stand on the device for 10 minutes per day, but in what's called a post hoc or after the experiment evaluation of the data, we were able to show that the women who stood on a device for at least 2 minutes per day, between 2 and 10 minutes per day, markedly and significantly increased bone, not only in their femur, their thigh bone, but also in their spine, right? So in the regions that we're interested in osteoporosis, 2 minutes per day, that if you did it for less than 2 minutes, they were just as bad as control. So it goes back to the light switch. See, I don't make this stuff up. I said, wow, look at this data. It says it's a light switch. As long as you turn it on, the women in 2 minute cohort were no better or no worse than the 10-minute cohort, but were better than the less than 2 minute cohort. But lo and behold, they had less fat, more bone, also more muscle in the paraspinous musculature. These are signals that your muscles are responding to as well. So the women standing on a device for 2 to 10 minutes per day built up muscle, paraspinous musculature, trabecular bone in the vertebrae, cortical bone in the femur, significantly more than the control group, and had significantly less fat in the thoracic cavity than the women who were the control group. So that's what actually got us thinking that it's not just stimulating bone or not just stimulating muscle. It made us think that it's the recruitment process. Why is there less fat? It's because we're telling the stem cells to become bone and muscle.
So that's bringing it back to the bone marrow that you weren't able to measure.
Right.
Yeah.
So, right. So there is a paper coming out by a group at the University of Pennsylvania in the Journal of Bone and Mineral Research by two of the authors, Felix Worley, who is the senior author of the group, also Mary Leonard, who recently went off to Stanford, who looked at postmenopausal women with osteoporosis, and they buzzed them on our device. And I can talk about it that way because I wasn't an author of this study. So, here's a paper that I think will actually be in the press next week.
Ooh, exciting.
So it's very exciting. And this gets back to your bone quantity versus quality. They have the ability, using really high fidelity MRI, resonance imaging, to look at the structure, the quality of the bone. And they were able to show that the quality of the bone in the active group, the postmenopausal buzzed group, improved, whereas the control group got worse, just as you would expect in a postmenopausal group. But to me, where it's exciting is because of the MR signal, they're able to look at the quality, not only of the bone,
MR signal, sorry.
the magnetic resonant imaging.
Oh, from the MRI machine.
The MRI signal, right. Thank you for keeping me honest here. The MRI signal can look not only at the quality of bone, it can look at the quality or the nature of the marrow.
Yeah.
They were able to demonstrate in the active group of these women that were buzzed that their marrow actually improved to be more vital than the women in the control group where it turned more towards fat. And remember, our take-home lesson is that once you allow your bone to become osteoporotic or your marrow to become fat, it's a bigger lift, no pun intended, to get your bone back or your marrow back. It's an easier go to keep it healthy rather than make it sick and try to make it better.
Mm-hmm. Okay, wow. That is a lot on that question on how does low intensity vibration improve bone health, but so fascinating.
Oh, good.
Really, really excellent, yeah, great listen.
In reality, remember the signals that I am delivering with my low intensity vibration device are exceedingly small. They're about 120 microns in displacement. This is small. And we're asking a lot to transmit this really subtle vibration up through your knees, through your hip, to your spine. That's called a transmissibility function. If you have 100% at the plate, how much of it actually reaches your spine?
Mm-hmm.
It turns out, without getting all mechanical engineer on you, it turns out that your musculoskeletal system is a viscoelastic system. That as a function of frequency, the material begins to deliver signals more efficiently. With me so far?
No, say the last bit again.
So if you take a kitchen sponge and fill it with water and squeeze it really slowly, the water will dribble down your arm, right? That's because, you're displacing the water out of the sponge. If you take that sponge and you slam it against the kitchen counter, the water explodes and goes everywhere, right? The sponge is a viscoelastic material. Its material properties and the way it displaces changes with frequency, just like your musculoskeletal system. So how do you depend on those really teeny signals reaching your spine? If I'm going to stand up like you, and I have my straight, well, I can't get far enough away, so I have to use you as the example.
Okay, if I stand and I lock my...
Right, and you lock your knees, right now your skeleton is working as a long, rigid system. And higher frequency signals are going to transmit pretty effectively up through your axial skeleton. Now you can try this, even with a low intensity vibration device, that once you bend your knees, the signal no longer transmits, because when you're like this, it transmits pretty well. Once you bend your knees, what happens is the mechanical signal is lost by the musculature in your legs. It's why
in the whole body vibration, they want people to do it to make things less aggressive.
Right. But the problem is one of physics. So if you got an 8G signal that's displacing, I think it's like 3 millimeters or something crazy like that, and everybody, your power plate friends will tell you, make sure you bend your knees. Why? Because if you stand up straight and you take 8G, that will all go to your brain case and shake your brain around, right? Or you try to clench your teeth, your fillings will explode out of your mouth. So they're right to insist that you bend your knees. The problem is to ask yourself the question, or your power plate friends, where does that vibration go? It goes into your knees. Well, if it goes into your knees,
It's not going to go up.
8G is delivered to your feet, and 8G goes to your knees and doesn't go to your head, it's lost as heat and mechanical energy into your knees and hip. Think of all of our poor football players, your son, the rugby player, the gymnasts, etc. What do they complain about when they're 40 and 50 years old?
Their knees.
Crappy knees,
Yeah.
crappy hips. That's because they've abused their joints over many, many years. Now tell your son to think of his rugby days, but to increase it to 30 times per second, it becomes a horror show. So physics, leave biology out of it. 8G delivered to your knees, that's abusing not only mechanical distortion in your knees, but it's dissipation of heat. Now, going to low intensity vibration, why you need to stand erect and straight. Now we're going to take advantage of the skeleton being a transducer rather than the case of high intensity vibration, avoiding the skeleton as a transducer. We're now going to take advantage of it. When you stand on the device, straight-legged, it's very efficient, about 80% at 30 cycles per second, where we study all of our sciences. About 80% of that mechanical signal is transmitted to your hip and to your spine. So it's a very efficient transducer. As soon as you bend your knees on a low intensity vibration device, the signal disappears. If you stand on a low intensity vibration device and you don't clench your teeth, but you put them very closely together, you can feel them just very slightly chatter a little bit. And it's a great way to make sure your device is working. As soon as you're putting your teeth together and feel them chatter, now gently bend your knees, your teeth no longer chatter because your skeleton is no longer transmitting the signal. Now, this becomes a problem because as it turns out, there's a reason we actually drive our plate at 30 Hertz. And there's a reason that we don't go above 30 Hertz, right? Even though I told you that muscle works between 20 and 50 Hertz, right? Sorry, I'm going to sneeze. I don't want to sneeze on camera. And that is that just slightly above 30 Hertz, the transmissibility function, the amount of signal from the floor to your hip and spine, which is very efficient at 30 Hertz, right? 80%, right? That above 30 Hertz, around 33 to 34 Hertz, it drops off like a rock, right off of a cliff. It goes from 80% to around 50 to 40%. And we did that study by putting pins in people's spines, volunteers, as crazy as that sounds, with these little microphones called accelerometers on the pins in the trochanter and in the transverse processes of the spine.
I hope they all got A's.
Oh, no, these weren't graduate students. I can't ask my graduate students to do this. But in the operating theater, we put the pins in the spine and we put the accelerometers, the microphones on them, and we show that as we increase frequency, transmissibility drops off. So even though your muscles are working 20 to 50 Hertz, it's like, this is great, let's buzz anywhere between 20 to 50 Hertz. Once you go above 30 Hertz, the signal is no longer transmitted, right? So it's very, very important that, at least from our perspective, that we stay within this window of 30 Hertz. And once you go above, the signal, even though it's potent biologically, if it doesn't reach the spine, it's of no consequence.
Okay, so now I have to ask a question because I would be upset with myself if I didn't. Have you, or do you have the information? Have you comparing what exercise creates a similar frequency to your 30 hertz?
Right. So I wish you hadn't asked that.
I had to. That's my life.
So there is, we would love to think of an exercise that basically mimics us rather than the other way around. Remember, I'm trying to mirror nature.
But everybody's going to ask me because they're so excited about,
Right. So unfortunately, unless you're a woodpecker or a hummingbird who happen to, hunt for insects or suck out pollen out of flowers at very high frequencies, unless you want to be a hummingbird, it's hard to do. It's just not how our system is built. And I'd go back to high magnitude vibration. What we're trying to do is to pretend to be a muscle. And even though our signal is very, 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 very small, it's huge compared to what your muscle vibration is doing. So remember, I'm telling you, or people who have kept up, that the predominant activity we do each day is to stand. What I'm trying to do is take that mechanical information that reflects 8 hours of standing, and I'm trying to compress it into 5 or 10 minutes by standing on a device. So the amplitude, our 0.4 G signal, right, 0.4 of 1 G, although you and I know that's very, very small compared to the heel strike during walking, compared to what a muscle normally sees, it's quite large. So we're tricking the muscle into thinking, and the marrow and the bone cells into thinking that it's running a marathon, or in reality you're watching, Nicole Kidman in The Undoing, which is great. But I could tell you what happens in the end because I've seen it all. But right, so there's not really a corollary to our experiment, to our exercise on the plate. It's more that, and I would say that I would go back to, sorry to be a gobbledygook, I would go back to the point that if you are a healthy 25-year-old who's active, don't go out and buy a low intensity.
They're not listening to this, don't worry.
Oh, well, okay, then my integrity remains clean. Because you want to stay as active as you can for as long as you can. It's just you can't beat aging. So as we age, systems begin to break down. So we're trying to take that person who is doing the right thing by walking around the block 2 times per day or trying to play tennis. Even though you're playing tennis every day at the age of 70, your system isn't as responsive. So I would say, and I'm not trying to sell you or anybody on listening a device, what I'm trying to say is that our experience has been that the low intensity vibration works independent or in synergy with people who are committed to exercise. I mean, let's remember there are FDA medications that are approved, or Canadian health medications that are approved for treatment of osteoporosis. We are not approved, at least in the US, for the treatment of osteoporosis. We are approved for treatment of osteoporosis in Europe. This is something to consider in conjunction with pharmacologic treatments for osteoporosis, or if you can't take them or you're philosophically opposed to them, then I would say eat right, choose your parents carefully, very carefully,
Right.
exercise every day, and consider low intensity vibration, because in the systems we've looked at, it's good for your marrow, it's good for your bone, it's good for your muscle. We've never had a serious adverse event reported in any of our clinical trials. From kids with Duchenne's muscular dystrophy, we were able to show a benefit to muscle, to bone, to the frail elderly. Everyone in between, never an adverse response. So to me, that goes back to where we started, which is first do no harm.
So can I just ask, because of the audience, in terms of, they're likely not going to have Duchenne's, although they might know of a child who has it. But, folks who've had joint replacements, who have plates and screws, because they're like, well, I don't want to, things vibrating too much. Or if they have, sorry, it's true, right? If they have Harrington rods, which, for people with scoliosis, they used to do to keep them upright.
Sure.
Those are the, only because I'm going to get these questions. So
yeah, sure.
I would rather the answer come from you.
Right. So I will tell you, it's sort of what my way. I'll start with a story. The very first experiment we did with low intensity vibration was to take porous bead implant, like a non-cemented total hip replacement. Basically you have a surface of the implant that you want the bone to grow into, to knit into. The very first experiment we did is we took an implant and put it in bone and we vibrated it, and we found that in the case of not loading the bone, an interface of fat grew there. That's why your orthopedic surgeon says, go out and be as active as, pain will tolerate, right? Because you want to stimulate the bone before you stimulate fibrous tissue. Then we loaded at 1 cycle per second, and we started to grow the bone into the implant.
Cool.
Lo and behold, we buzzed the bone, and it knitted actually pretty voraciously. So that was very exciting. That was work that was published many years ago. Since then, we have done studies of all things in sheep, where we create something called an osteotomy, where we create a sort of salami slice in the bone, and we buzz the bone, and we're able to show that we can accelerate and augment the healing of fractures. And now people in Hong Kong have shown in femoral neck fractures, standing on the device, that they can accelerate the healing of femoral neck fractures. But back to your actual question of, is it safe for your patients? Well, it turns out in a clinical trial that we did with colleagues at Harvard, with Doug Keel at Harvard, we were recruiting a group of frail elderly, people between 75 and 95. And the problem was, we couldn't recruit anybody because everybody had rods and total joints and total knees and total hips. And we were basically beating ourselves out of this. And we went back to the Human Studies Board and explained, just like the heel strike, that the magnitude of the vibration, the 100 microns of displacement, is so much less than you walking down the street that we were able to convince the Human Safety Board that it was safe to actually subject our
do your study, yeah,
to these devices. Everybody came in, and again, no adverse events, no loosening of rods. We weren't looking at outcomes like were we growing bone into implants, et cetera. But it's a question I'm asked a lot, and we have never, ever had an orthopedic surgeon or a patient come back to me and say, hey, my implant is looser now. And in fact, we believe, and in a trial we're trying to start now, and one of the big orthopedic challenges out there, spinal fusion. Remember, we started with high magnitude vibration causing back pain, but one of the biggest orthopedic challenges there is with spinal fusion. Can we use people standing on a device to accelerate and augment the fusion of their vertebrae? We believe, because of our studies in human fracture and studies in animal fractures, accelerating, augmenting it, that we can. So again, it's a conversation you need to have between your family, your physician, your orthopedic surgeon, et cetera. But the signals are 0.4 G, whereas you're walking down the street at 1.2 G, you're safe, I think.
Dr. Rubin, thank you for the work that you've done over the years, researching cellular mechanisms that help people improve their bone in a healthy and safe manner. And, I will do what I can to get the word out there, but we do need to get that information to people because it's so wonderful. And it's such a viable alternative. And, and really, I was chatting with my husband at breakfast and I went, when you think of exercise and low intensity vibration, it's like a match made in heaven. It's like bring them together. So I just want to thank you so much. I know you have to go teach a class.
Actually, I have to go teach a class. Hopefully I still have a voice to do it. Yes, I'm off to teach these poor students. But thank you, Margaret. Thank you so much, for giving me the time to speak to your group. Hopefully it was interesting. Hopefully, nobody's asleep. And yeah, I think that my passion, my enthusiasm for this is because nature's been around for a long time. Every system is mechanically sensitive, mechanically responsive. It's been around a lot longer than drugs, et cetera. All of these sort of algae, et cetera, growing up, over billions of years, they've learned how to deal with gravity, and we're just trying to harness it. So get out there and exercise. Don't eat too many Oreos. Don't binge watch too much, and make sure you run to the refrigerator, and at least it's a start. Thank you so much.